We're going to apply a soft padded bandage with a bivalve cast. First, we're going to place some stirrups using 1-inch white tape. And you can place them either medially and laterally or on the palmar and dorsal surface as well. If you stick them together, it just keeps them out of the way, and then fold the tape under at the bottom. Makes it easier to get them apart. So, as you can see, we have a wound. So we're going to apply a primary wound layer. In this case, we are using Mepilex for our primary wound layer. Actually, no, we're using, we need another one of these. So this can be cut to the size of the wound. So we can apply this directly to the wound. There. The silver ions help to prevent superficial infection and provide a little padding to the wound. We will apply a layer of cast padding. This one is called Pro Touch Plus. It's nice to work with. Has a little bit of stretch, easy to apply. So we want to start at the toes, but we want to leave the middle 2 toes visible so that we can assess whether there's any swelling in the foot. So we always start at the bottom, and we're going to roll the bandage off the roll in this direction rather than that direction, which makes it awkward to roll. So think of starting and rolling off directly onto the limb. Ideally, try to leave the limb in a fairly functional position or weight-bearing position rather than putting the patient in an abnormal position. And in this case, we're just going to use a fairly short, cast. We just want to protect the wound and prevent excess motion over the wound. So, but the principles of bandage application are still the same. Now, we'll put a little more of the cast padding for a little extra protection. Areas to pay attention to when you're bandaging the hind limb as well include the calcaneus, so making sure there's good padding over the calcaneus. On the front limb, the olecranon. And we want to aim to overlap the bandage material by about 50% as we roll it on. And trying to avoid wrinkles and making sure that application is even. So at the top, I'll often go around one full time. Next, we'll apply a layer of conform to hold this bandage together a little bit better. This has a slight stretch to it. Sometimes people call it roll gauze. The same principles apply. Start at the bottom, go around once, and then start to overlap by about 50% as we move up the leg. And I'm not applying it tight, I'm just rolling it on. The more padding that you have, the tighter your bandage can be, but of course we need to be very careful not to over tighten and to monitor for any kind of swelling. Okay, you can put your finger there. Thank you. Now, if we were going to just apply a tertiary layer or a vet wrap layer at this point, we would undo the stirrups, fold them up, and apply our final layer. Give it a little twist and then stick it up like that. And same thing, we would start at the bottom, make sure we can see the toes visible, and start to apply. But in this case, we're going to apply a fiberglass cast and then bivalve it. So this will be our final layer. We'll get to the cast part at this point. This is a fiberglass casting material. It comes in 2-inch, 3-inch, and 4-inch sizes. It's very versatile and can be used for many things in the clinic. So here we're going to apply a full cast and then bivalve it, but you can just as easily make splints or half splints out of it. So once you take it out of the package and it's in its roll, you dunk it in some cool to cold water. That will actually allow you more time to work with it before it hardens and activates. Squeeze the water out, and then we will start to apply it much like the other layers of our bandage. So again, at the bottom, I will go all the way around once or twice to make sure that I have a nice beginning, and then proceed up the leg, overlapping by approximately 50%. And trying here carefully to avoid wrinkles and pressure spots. Whoever your assistant is holding should try to hold with an open palm as opposed to finger pressure, which can create pressure points or divots in the material. Again, at the top, we'll go all the way around. I'm not going beyond the level of our padding because I don't want to create any kind of sores on the skin. We'll come back down. This material undergoes an exothermic reaction as it hardens, so you have a few minutes to work with it and then you'll start to feel it warming up. That's what happens then as it starts to harden. Okay, all right. And there's always a little fold material at the bottom. You can use a little water just to smooth it down. All right, so what we'll do is the limb is in a nice weight-bearing position. We're going to hold it like that with open palms and let it harden. It's starting to warm up, so we can feel the heat. Okay. All right, so now we have a nice hardened cylinder cast. And as you can see, I've drawn a line to guide me with the bivalving. There's another corresponding line on the back. And you can also make the lines medial and lateral if you desired a different orientation of your two clamshells or two halves of your splint. So we're going to take a cast cutter. This is a specially designed cast cutter. The blade oscillates, so it's designed that it won't actually cut through skin. And we're going to cut along both lines to create two perfectly conforming halves of this cylinder cast. So you can see when that goes, you can actually touch it to your skin and it doesn't cut through. So the way to do this, is you want to always brace the cast cutter against it so you've got good balance and control, and then you press in, release up, move slightly, press in, release up, move slightly, press in, release up, move slightly, rather than an actual sawing motion. You don't want to drag it along. You want to go through, out, move, through, out, move, like that. Okay? So that's what we're going to do. one thing I would say is it does generate some heat, so don't spend too long in one spot. That's why you can see that I was going in, coming out, moving, going in, coming out, and then going back and just making sure I was all the way through all the layers of the fiberglass, rather than staying in one spot too long. So as you can see, we've cut through the fiberglass material, and then I've just taken a scalpel blade and just kind of run along the conform just to loosen it a little bit. It just makes it easier when you go to take it off the next time. The other thing is you can take your scissors and just also place them inside and just start to cut that early layer, that layer of conform, just so that the next application, the removal will be very simple. This is the only time that you'll need to do this. Good, and then you can see it will actually clamshell off, and the back has also been cut. I may do the same. And then what we're going to do is just apply simply our vet wrap over top, squeezing the two halves back together again. So we'll come back to that in a moment. So as you can see, we've also separated the back and made sure that it will easily come apart, so that next time when we do a bandage change, our patient doesn't necessarily have to actually be sedated. I find it's helpful to sedate them the first time for the cast application and the bivalving, but subsequently, because there won't be any sawing or things like that, we'll just be able to remove each half, change our dressings, rebandage the leg, and then finish it off again. And then we have a nice, perfectly conformed, custom fitted splint. So our final layer is going to be our outer layer, our vet wrap. Now remember, this layer, we're trying to reestablish most of the stiffness of this cast, so we can't really over tighten this as long as we stay on the outside of the casting material. Some people will actually take tape and tape it first. You can do that as well. So we're just going to apply this over top, and again, just trying to reestablish, other way, same way. We're going to roll the material off like that, and we're going to reestablish the 360-degree cylinder effect of our cast. So I'm just going to get that one on fairly snugly, and then proceed up the leg. So again, overlapping by about 50%. As we go up the leg. The other nice thing about applying a cylinder cast like this and then bivalving it is if there is any problem with swelling of the foot or something happening to the skin underneath, it's easy for anybody to remove this. If you leave it as a cylinder cast, it can be difficult unless you have a special cast cutter to actually remove that. So we never want to put our patients in a position where, if they have to be taken to an emergency clinic overnight, that somebody can't get this off. So that's one of the reasons I really like that. Which leads me to our final comment about anytime we put bandages on. Again, you can see the toes here, so we can check those for swelling. I'd like to talk to people about making sure that the nails are still close together and the pads are close together. If you start to see a swollen foot, you start to see the nails splay like that and the pads splay, so they tend to look something like that. If you see something like that, it's a sign that that needs to be removed and changed right away. So when we leave something like this in place, typically we don't leave that for more than a week at a time without having a bandage change and bandage check. It's always easier to find small problems developing early and prevent them from becoming worse than find a disaster of a problem many weeks later. And especially with something like this, with a wound, we're going to be changing this probably at this point with that wound, every 3 to 5 days would be quite fine, possibly even a little bit longer. So again, making sure we can see the toes, that owners are well versed in what they need to monitor, and instructions about keeping this clean and dry, putting a bag over the end of the foot when they go outside so that they don't get dew or other moisture seeping up the bandage, and recommending that if they have any concerns, it's always better to have it checked than not.